Your arteries are clogging right this very moment and you feel absolutely nothing. No pain, no warning sign, no alert. That is exactly what makes arterial disease so dangerous. It is completely silent until suddenly it isn't. But there is something almost no doctor explains to you. There is a pill you have in your medicine cabinet right now, one that has been studied for decades. And when used correctly, it can protect your arteries in a way no other over-the-counter medication can match. That pill is aspirin, and today you're going to learn exactly how to use it, when to take it, and at what dose. You'll learn what to combine it with and what serious mistakes you must avoid at all costs. Hello, I'm Dr. Manocci, cardiologist with over 20 years of clinical experience helping patients care for their heart. I've helped thousands not depend solely on expensive and complicated treatments. Today I'll reveal my exact protocol. The goal is for aspirin to work in favor of your arteries in the most effective way possible. Pay close attention. Do you feel chest pressure from time to time and don't know why? Have you been told you have high cholesterol? Are you over 50 and has your doctor talked to you about cardiovascular risk? Then this video can save your life. Stay until the end because mistake number 4 is the one made by 80% of people worldwide. That mistake makes aspirin not only useless, but potentially harmful to your organism. Don't allow it. Before continuing, I want to ask you a small favor. If this medical content is useful to you, please like and subscribe. Your support allows this information to keep reaching millions who need it and that nobody else is giving them. Thank you. Now I want to tell you about Robert, a 62-year-old patient who came to my office almost 2 years ago. He had the face of a tired man, not from sleep but from the worry he carried. Dr. Manocci, he told me, lowering his gaze toward his hands, my father died of a heart attack at 64. My brother had a stroke last year. I have cholesterol at 240 and pressure at 145/90. His primary care doctor told him he had plaque in his arteries. He prescribed statins, changed his diet, and sent him home. But nobody explained what else he could do. Nobody told him if aspirin helps. They just told him to be careful. Robert had done everything right for almost a year. He reduced fats, eliminated processed meats, and walked daily. But he lived with a silent fear that kept him awake. The fear that one day, without warning, his heart would stop. When I reviewed his complete history, I saw something very clear. Robert could benefit enormously from aspirin therapy. I dedicated that consultation to explaining how aspirin works, why it's not just for headaches, and what its exact dose is. 6 months later, Robert returned with a smile. His arterial inflammation levels had dropped by half. Robert slept peacefully, not because risk had disappeared, but because now he felt he was doing the right thing. Now let me explain the same thing to Robert. First, understand what happens to your arteries when they age. Your arteries don't clog overnight. It's a process that takes decades and begins with a microscopic lesion. This lesion occurs in the endothelium from factors like tobacco, high pressure, excess sugar, and chronic inflammation. When the endothelium is damaged, bad cholesterol begins to infiltrate inside the arterial wall and plaque forms. That plaque grows slowly for years, hardens the artery, and reduces the space through which blood flows. The real danger occurs when that plaque ruptures or cracks. At that instant, the organism sends cells called platelets. The platelets cluster, form a clot, and that clot can block the artery completely in a matter of minutes. If it happens in the coronary artery, it's an infarction. If it occurs in a brain artery, it's a stroke. The most lethal events. And this is where aspirin enters. At low doses, it acts on platelets in a completely different way. It irreversibly blocks the enzyme COX-1, which is what activates platelets' ability to cluster and form clots. A single 100 ml dose deactivates platelets for their entire useful life, which is 7 to 10 days. It's a potent effect. This means your arteries have much less probability of a sudden blockage, even if a plaque ruptures. Additionally, aspirin has a direct anti-inflammatory effect on the arterial wall that slows atherosclerosis progression. Aspirin helps keep arteries cleaner and safer because it acts on coagulation and inflammation simultaneously. Now I'll give you the exact protocol. Point number 1, the correct dose. This is the most common error. Many take 500 milliliters or 1000 milliliters, the dose for pain or fever. Long-term, that severely irritates the stomach. High doses can cause ulcers and increase bleeding risk. Not what we want for daily protection. For arterial protection, the correct dose is between 75 and 100 milligrams a day. No more, no less. That's the standard. I recommend enteric-coated tablets. They dissolve in the intestine, protecting your stomach from unnecessary irritation. Point number 2. The exact time of day to take it. There's a detail very few know that makes a difference. Infarctions occur most frequently between 6 a.m. and noon. The body activates coagulation upon awakening. Upon waking, pressure rises, cortisol increases, and platelets are more active. It's the moment of greatest danger. Taking aspirin at night produces higher protection levels during those critical morning hours. Take it between 9 and 10 p.m., always with water and never on a completely empty stomach. A yogurt is enough. Point number 3. Foods that enhance its effect. Aspirin doesn't work alone. Its effect multiplies with the right diet. The first is extra virgin olive oil. Its oleocanthal has an anti-inflammatory effect comparable to ibuprofen. 2 tablespoons a day create a less inflamed arterial environment, more receptive to aspirin's work. The second is raw garlic. It contains allicin, which reduces platelet aggregation and dilates arteries directly. The third is red berries, rich in anthocyanins that reduce LDL cholesterol oxidation, the great arterial enemy. The fourth is oily fish, salmon, sardines, or tuna. Its omega-3 improves blood fluidity and lowers triglycerides. And the fifth is green tea. Its catechins protect the endothelium and improve your arteries' elasticity. A cup a day is enough. Point number 4. Serious mistakes you must avoid. This point is crucial for your safety. Give me all your attention. Error 1. Taking aspirin with anti-inflammatories like ibuprofen. Ibuprofen blocks aspirin's protective effect. If you take them together, you basically nullify the cardiovascular benefit for hours. Never take them simultaneously. Error 2. Combining it with strong anticoagulants without supervision. This dangerously multiplies hemorrhage risk. Error 3. Taking it if you have an active gastric ulcer or history of digestive bleeding. Always consult first. And error 4, the most frequent, interrupting it abruptly. Stopping suddenly causes a dangerous rebound effect. Platelets recover their ability to clot acceleratedly, which can increase cardiovascular event risk. Point number 5, who it's recommended for and who it's not. Science is clear on who benefits most. It's recommended for people who have already had a heart attack or have diabetes, hypertension, and high cholesterol combined. However, in young and healthy people without clear risks, the benefit doesn't always outweigh bleeding risk. The most important rule is this: aspirin as arterial protection must always be indicated and supervised by your doctor. I'm not interested in you leaving to self-medicate. I want you informed to ask the right questions to your doctor. That was what changed Robert's life. Understanding how it works, when to use it, and what errors to avoid at all costs. That knowledge gave him back the peace of mind he so needed. And today, you have that knowledge too. Today you discovered why aspirin is so powerful. 100 mmol dose, night before bed, with a protected stomach. Enhanced with healthy foods and avoiding ibuprofen mixes, concrete steps for a longer, healthier life. My advice for today: in your next medical visit, ask directly if you are a candidate for this protocol. Bring this video if necessary. That question may be one of the most important you ask in your life. If this video was useful, share it now with someone you love. Your partner, siblings, parents, help them. The information you received can save a life that needs it and doesn't have it yet. Be the messenger. Leave me in the comments which point surprised you most. I read them all to know what info you need more. Also tell me from what city you watch us. It's incredible to see how many corners this small screen reaches. Don't miss the next video. I'll explain the 5 signs your arteries give you to warn that something isn't right. Signs almost everyone ignores for seeming trivial, but that we cardiologists recognize immediately. Don't miss it. Take good care of yourself. Your heart and arteries are worth every minute you dedicate to them. I'm Dr. Manochi. See you soon.